Now, let's see. No more people. Let's wait for the other people to enter. And we start, okay? Now, I have certain type of questions for you. We already talked about that your health really matters, that you're supposed to really take care of your health. And how often you get sick? How often you get sick? Once a year, twice a year, when the season changes from summer to winter or from winter to summer? How often do you? Most of the time we have a flu, a cold. Sometimes when you ate too much, probably, or sometimes you go to the dentist because there was a problem. So how often do you go how often do you get sick? Once a year, twice a year? How often? No?
I get three sizes.
3 times a year. Okay, probably 3 times a year. How often do you have a flu? How often do you have a flu? ¿Cuán seguido les da gripe?
Once 2 years.
Once every 3 years. That's good. That's really good.
In winter.
Once in the winter. Yes, because it changed. Okay. Another one? No? Okay. Now, why am I asking you about this? Because the last part of the unit talks a little bit about the treatments. How do you treat your flu? How do you treat your cold? What do you do? What do you drink? You go to the doctors, or probably when you know that you have a cold, probably you take certain type of things. Probably you take a certain type of medicine, or probably your mom, your grandma, or your father, probably they prescribes you. Why don't you take this? They're not doctors, but they tell you, why don't you drink that? Why don't you eat this one? Why don't you get a shot of this one? So they are start recommending you a lot of things. Probably you go to the doctor when the flu is a kind of complicated and you notice that you're not recovering. For you, in your opinion, what is the amount of time that when you have a flu, you should recover? What is the amount of time that you consider that you're supposed to have a flu? And after those days, you don't get better, you go to the doctor, but you know that it's a problem. How long do you think that is the recovery from a flu? 15 days? 1 month?
5 days.
After 3 days?
In 3 days?
Yes.
Okay. In 20 days? Is it too much? Muy largo. In a month?
Yes.
Si pasan un mes con la gripe, ¿irían con el doctor?
Yes.
Yeah.
Probably, yes. It's too long. A month that will be too long. But depends of your condition, depends of the body, depends of the things that you have drank before. Okay? Now, I'm asking you all this because we know that there are different type of treatments. When it's a regular cold, when it's a normal and regular cold, what do you drink? What does your mom or your grandma tell you to drink?
I drink Tapsin or Vitaperena.
Very good. Another one?
I drink some tea.
You take some tea? No todos les gusta tomar pastillas, entonces se van por lo natural. ¿Qué es algo natural que puedan tomar para la gripe? Té. ¿Qué más? Algunos absorben el olor de eucalipto, ¿ok? O tienen difusores de aromas y utilizan eso. So we're talking about, what are we talking about this? Because the next topic talks a little bit about the different type of treatments. Treatments are different type of medicine. No, all the people believe in the traditional or conventional medicine. What is the traditional or conventional medicine? When we talk about conventional or traditional medicine, what do you think is the traditional medicine or the conventional medicine? Is when you go to the doctor and the doctor spends like, I don't know, 10 years, from 10 years to 15 years studying in order to get a specialty or to be a general doctor, okay? And they were trained based on the conventional medicine. Conventional medicines are like when you take some pills, when you have certain type of pills, that means they're drugs, okay? But drugs that are good for your body, okay? That is the conventional medicine. And when we talk about conventional medicine, it says is a system in which medical doctors and another health professionals, such as nurses, pharmacists, and therapists, treat symptoms and diseases using drugs, radiation, or surgery. So the conventional medicine, you go, and when there is nothing that they can do, but there is a surgery, so they practice. Also called allopathic medicine, biomedicine, mainstream in medicine, orthodox medicine, or Western medicine. All those type of names are the known as conventional medicine. Treat your conventional medicine, and sometimes with the conventional medicine you cannot find a cure, or there is no cure for the type of disease you have. So you start testing, or you try another type of medicine, another type of treatment. And another treatment, natural form of medicine used by over 2 million people worldwide to treat both acute and chronic conditions. So some acute that happens and they live and they pass and that's it, or chronic conditions like, okay, in other words, plants. It says take a small amounts will cure the same symptom if, example, what is this? Say diluted in water, and most of the time you drops. That is the homeopathy. And don't worry, because we have the reading in the book. Homeopathy usually taken in tablets or pills, but also available in liquid or a powder form. Okay? Prescribed by homeopathic gels or cream or patients. You can have pills, you can have tablets, liquids, you can have powder. What is powder? China that can be traced back in the list 250 years ago. The general theory of acupuncture is based on the premise that there are patterns of energy that flow in your body, okay, that are essential to heal. Acupuncture is a family of procedures involving stimulation of anatomical location on or in the skin by a variety of techniques. There are a variety of approaches to diagnosis and treatment, and American acupuncture that incorporate medical traditions from China, Japan, Korea, and other countries. Okay, what is exactly what they use? They use needles, which are manipulated manually or by electrical. Put it in place that you're supposed to pain in certain parts of your body connect to the brain that will give you a sign that probably you will feel a little bit better. So you have conventional medicine, you have homeopathy, and you have acupuncture. The other one is the herbal therapy. ¿Qué creen que sería la herbal therapy?
Natural medicine.
Ok, natural medicine. Cuando usted está malo y le duele el estómago, por lo general las abuelitas que le dan a uno.
Licuados o infusiones.
Ajá, un tecito de algo. Y si los niños están enfermos. ¿Yes, Oscar?
Tea de manzanilla.
Yes, ok. O cuando los niños están empachados o no sé, o tienen algún malestar, a veces hasta les colocan bandas o los enrollan o los envuelven y les ponen algunas plantitas y cosas así. So those are herbal therapy. Okay, it's a part of a complete medical system which has diagnosed, treated, and prevented illnesses for over 23 centuries. Remember that long time ago, we didn't have doctors. We didn't have any type of medicine. So they started with herbs. Okay, and nowadays, it's still a therapy by using herbs. Okay, and the other one is the spiritual healing. The spiritual healing is usually a mixture of interventions, physically and medical and non-medical. Energetic interventions and mental interventions, when we transfer the cause of our illness or disease and grow beyond the problem, we are then focused in the healing. Okay? The idea of the spiritual healing is like they believe that your mind, your body, and your soul are connected. If you think you're ill, you're ill. But if you believe in a spiritual healing, like you believe in God and you have faith and you have probably you tried a mixture of techniques. You go to the doctors, a conventional doctor, it didn't work. And then you try the homeopathy and you try the acupuncture. But every time you try new techniques, you're thinking about that you're getting better and you were praying to your God, whatever God you believe in. And that's then the way they heal. That's what they say. In a spiritual healing, we create a medicine story for ourselves that is both curing process and healing destination. A spiritual creates a special prescription for the body, heart, and mind. Spiritual healing is path of transformation, a journey that connects the body, your heart, your mind, and your soul. Okay? I don't know if that works or now the spiritual meaning, spiritual healing in the book is presented like when you 20 when you pray. Do you believe in God? Probably yes. It could be your God could be different from my God, but everyone believes in a God. Or probably you don't. But it's okay. You believe in another thing. Okay? That is the kind of idea of a spiritual healing. Many people believe that meditation and pray may help you to heal the disease. Okay? And don't worry. We're going to talk about one by one. Okay? Let me get this one here.
Read and listen.
Okay. And let me take one. The conventional medicine, most of us, we have tried the conventional medicine. Yes or no? Yes?
Yes.
Everybody tries the conventional medicine. For example, there are a lot of different people that they don't find a cure for the disease that they have. Probably homeopathy, spiritual healing, acupuncture, probably they don't have a cure, but they give you peace. They give relaxation. They make them feel better. Okay? So that's why they go to this different type of treatment. Okay, let's go for the first one.
Listen. Consider the choices. Conventional medicine. The beginnings of conventional medicine can be traced back to the 5th century BCE in ancient Greece. It is based on the scientific study of the human body and illness. In the last century, there has been great progress in and new medications. These scientific advances have made conventional medicine the method many people choose first when they need medical treatments. Homeopathy. Homeopathy was founded in the late 18th century in Germany. It is a low-cost system of natural medicine used by hundreds of millions of people worldwide. In homeopathy, a patient's symptoms are treated with remedies that cause similar symptoms. The remedy is taken in very diluted form, 1 part remedy to 1 trillion parts water. Acupuncture. Acupuncture originated in China over 5,000 years ago. Today, it is used worldwide for a variety of problems. Acupuncture needles are inserted at certain points on the body to relieve pain and/or restore health. Many believe acupuncture may be effective in helping people stop smoking as well.
Okay, let's suppose that you can stop smoking. So you go to like in a session of this one and probably you will stop smoking. Probably. Okay, let's go for the last two. Just let me move this.
Herbal therapy. Herbal medicine, often taken as teas or pills, has been practiced for thousands of years in almost all cultures around the world. In fact, many conventional medicines were discovered by scientists studying traditional uses of herbs for medical purposes. The World Health Organization claims that 80% of the world's population uses herbal therapies for their regular health care. Spiritual healing. Also known as faith healing or mind and body connection, various forms of spiritual healing exist around the world. This is a form of healing that uses the mind or religious faith to treat illness. A number of conventional doctors say that when they have not been able to help a patient, spiritual healing just may work.
Okay. Now, this is a kind of controversial thing because imagine that, but now there's been different things. Have you heard about that there's a lot of doctors that probably they believe in science because they were taught in that way? I believe in science. Everything has a purpose. Okay? But there are some other doctors that probably they believe that when you combine all these type of treatments, probably they will make you feel better. So probably you find a specialist that they are conventional or they work with conventional traditional medicine, but also they have tried or they have practiced acupuncture and they say that it works. Or probably they are people that are really faithful people that are very spiritual, and they believe that when you combine that conventional medicine or any type of treatment that you choose, they believe that if you have faith and you believe in your heart and you pray to God that you're going to be sane or you're going to be cured, probably happened. So it's like a mixture of theories. Now, from all the different treatments that you see here, which one have you tried? Which one you have tried? Conventional medicine, everybody. I think that everybody has tried a conventional medicine. Another medicine that you have tried that you said, that really helped me a lot. Or which one you be interested in trying?
Homeopathic.
Homeopathy. Have you tried homeopathy?
Yep.
And it works for you?
Yes.
Yes. What I have seen, or what they have told me, is that with homeopathy, the results, they take more time, because you're supposed to be constant. Yes, there is certain type of constancy that you're supposed to have in order to see the effects. Is it true?
Yes, it's true.
Okay. Have any one of you tried acupuncture? Would you like to try acupuncture?
No.
No, why? Because of the needles, por las agujas.
Yes.
Okay, probably. What about the herbal therapy? Creo que todos hemos probado herbal therapy, yes? Más de algún té nos han dado, yes?
Yes.
Yes. Yes.
Okay, desde que somos
Licenciada,
chiquitos, yes?
a mí sí me han hecho acupuntura porque yo
Yes.
sufrí derrame cerebral
Ujú.
y es muy bueno.
Sí lo recomienda.
Yo,
Y,
yes,
y las agujas no es tan doloroso, o ni se sienten.
bien se sienten, pero es muy bueno.
Ah, ok. Aquí en Guatemala.
Sí, en la iglesia hay un hermano que hace de esos trabajos
Ah,
y es muy bueno.
ok. Thank you, Julio. Thank you very much.
Está bien.
Thank you, Julio. Spiritual healing? Yes. Como dicen las abuelitas, cuando sea lo que usted, para todo lo que usted haga o piense, siempre hay que encomendarse a quién. ¿Recuerdan?
Yes.
Ajá, eso dicen, okay? So, do you believe in God? I'm not asking you which is your God. Do you believe in a superior force that helps you?
Yes.
Yes, okay.
Yes.
Everybody believes in a superior, I don't know, force. It could be God, any type that you want. But you combine all this type of treatment, probably you have to have faith that they're going to work. Okay? And that's what the book is telling you. Okay? All different type of treatments, and some of them work, and some others probably for you, yes, and for others probably not. Okay? Now, look at this one. 4 of these words, they have the similar meanings. Cross out the 4 words that they not belong to the reading. Which one of these they have the same, and which one they don't have the same? They say that you're supposed to cross out the words that they don't belong to the group of words. Which one do you think that they don't belong to the group of words? Todo está relacionado con la lectura.
Treatments and therapies? Similar?
How?
Treatments and therapies are similar?
Ajá. But you have to cross out las que no. ¿Ok? Después van a quedar las que sí son similares. ¿Cuáles serían las que no? Iniciemos con una. Uses. Esa no. Les quedan 3. Which one could be?
Purposes?
Purposes? Yes. Okay. Let's go with 2.
Illnesses?
Illnesses? Yes. And another one?
Symptoms?
Yes. Very good. Entonces, si se dan cuenta, nos queda medications, treatments, therapies, and remedies are the 4 words that are related to the reading. Okay, we talk about medications, we talk about treatment, we talk about different type of therapies that you might take, and the remedies. Okay, Very good. Now, according to the reading, you're supposed to advise these three people what type of treatment do you consider they would choose based on what they say. It says, number one, it says, I definitely want to see a doctor when I have a problem, but I want to avoid taking any strong medications or having a surgery. So I want to go to a doctor, but when they give me a treatment, probably I want something that is soft, no strong medications, and I am avoiding the surgery. So what type of treatments do you think that you should, that probably this person might try?
She might try homeopathic.
Uh-huh. What else? Probably acupuncture and definitely the conventional medicines, because it says definitely I want to see a doctor, but depends of the prescription that he's giving me. Probably I will go to another type of treatment because I don't like to take strong medications or avoid surgeries. Look at the number 2. I believe you have to heal yourself. You can't just expect a doctor to do everything for you. What type of medicine do you think that this type of person likes?
Spiritual healing.
Uh-huh. Probably he preferred the spiritual healing and homeopathy, probably. Okay. Number 3, I think it would be silly to try a healthcare method that isn't strongly supported by a scientific research. I mean, she definitely believes in that.
She might try conventional medicine.
Probably she's 100% believer that conventional medicine. Why? Because only conventional medicine are tested and they have scientific research. That's what they're talking about. Okay. Now, let's stop here and we're going to go to a exercise. So we have all these type of medicines. Okay. Now, you have to put in order the words or put it in the right category. A checkup, spiritual healing, an x-ray, and all of the words are divided in 3 categories. Dental emergency, which is a medical procedure, and which one is a treatment. Let's start with dental emergency. In this category, which one do you put? A dental emergency.
A broken tooth.
A broken tooth? Uh-huh. What else?
Swollen gums.
A broken tooth, swollen gums. What else?
A loose tooth.
A loose tooth. Uh-huh. ¿Qué más?
A toothache.
A toothache. Uh-huh. Very good. Another one?
A lost feeling.
A lost feeling. Uh-huh. ¿Qué más?
A checkup. No. It's person.
Okay. Now, let's move to medical procedures. A medical procedure is the one you told me.
A checkup.
Uh-huh. What
A
else?
blood test.
An x-ray.
A
An
blood test.
x-ray. An EKG. Okay.
EKG. Ajá. ¿Qué más?
An injection.
An injection. Mhm. Okay. And now, what is a treatment?
The recent. Homeopathy.
The one that left.
Homeopathy.
Very, very good. So that is the different. Now you have it there. A dental emergency is a swollen gums, a loose tooth, a broken tooth, a lost feeling, or a toothache. Easy because they are dental. Everything has to do with the teeth. Medical procedures are all the type of procedures that when you go to a conventional doctor, they prescribe you these type of procedures in order to give you like a more certainty prescription. Okay. An EKG, an X-ray, a blood test, a checkup, an injection. Most of the time when you go to the doctors, he prescribes you a medical procedure. Okay. And treatment are the words, probably are the different type of medicines that exist. And it is your decision if you take homeopathy, conventional medicine, acupuncture, herbal therapy, or a spiritual healing. Okay, those are the different type of things. Any questions so far about this one or about the reading? Now, everything. Okay, now after all the things that probably you have seen or you already know this type of different treatments, okay, what could be your second choice? You go to the doctors with the conventional medicine, but probably you would like to try another one for the probably for the disease that you might have. I will combine my conventional medicine with what? For example, you will say, I only would like to combine two. I will try the conventional medicine and I will try the spiritual healing. If I have faith, if I believe in a superior force is going to help me, probably the conventional medicine is going to give me a nice treatment for the thing that I have. And other people might think, probably I will combine the conventional medicine, the herbal therapy, and the spiritual healing. Because homeopathy, start drinking all these different acupuncture, no, because of the needles. So you may combine all this. From all the treatments that you see here, which ones or which one do you believe are the expensive, the more expensive treatment?
Probably a conventional medicine is more expensive.
Okay.
Or surgery or
because
procedure.
probably because of the surgeries. If you need a surgery is very expensive. A lot of different type of procedures, and every procedure it's expensive. Another one that goes in second place, what do you think, which are the treatments that could be really expensive? Probably yes.
Probably acupuncture.
Acupuncture, probably yes. It's not so common in Guatemala. There are a lot of places in Guatemala, but it's not so common that our people, go to this place. Probably it's more focused to the Asian people that probably lives in Guatemala and they go to this one because this is the type of treatment that they have in their countries. Okay, probably. Which one do you think is the cheapest?
Spiritual healing.
Uh-huh. Another one?
Herbal therapy.
Yes, herbal therapy. Probably you go to the market and you just buy a bunch of chamomile. Compra la manzanilla, ramitas o la hoja de manzanilla. Eso sale mucho más barato que comprarse un frasco de medicina. Okay? Probably. Okay? But it's your decision. Okay? And now we're going to move to, since we have tried dental emergency, medical procedures, we have the symptoms. We need a different type of treatments. What is it missing? It's missing the medicine. Medicine that you take. Of course, there are a lot of different type of medicine, but these are like the most common type of medicines and the vocabulary that probably we might try. Okay? It says, talk about medications. Medications. Okay? When you have, in Guatemala, it's not very common. When you go to the IX, ¿muchos han ido al IX o tienen familiares que van al IX? Yes?
Yes.
¿Cómo les mandan las medicinas cuando van al IX? ¿Cómo viene la medicina, el envase? ¿Cómo viene? ¿Cómo saben que es de una persona? Viene en una cajita, se lo dan en un sobre y le dan la cantidad de pastillas. Si son 20 blisters, los 20 blisters enrollados en tape o en algo, y aquí está su medicina y le dan su receta y ya. Okay? That's it. But it says medicine label information. Probably in Guatemala, they don't do it like that, but in United States, if you realize, if you have seen movies, that they have the medicine, the medicine is labeled. It's labeled, and the information in the label says the dosage, the warnings, and the side effects. And they also have the doctor, the name of the doctor, and the name of the patient. Okay? And the dosage. It's supposed to be taken 1 tablet a day or 2 tablets per day. Those are the dosage. Okay? In a minute, we'll return. Let's try to listen this vocabulary.
Listen and repeat.
Dosage. Warnings. Side effects.
Which are the side effects? What do you think are the side effects? When you take a medicine, they could have a side effects.
Efectos secundarios.
Ajá, los efectos secundarios. Okay? That's why when you go to the doctor's office and they ask you, do you work? molecules, the side effects, the warnings, everything. Okay? So let's listen to the vocabulary.
Read and listen.
A painkiller. Cold tablets. A nasal spray. A decongestant. Eye drops. An antihistamine.
Cough medicine. An antibiotic. An antacid. An ointment. Vitamins.
One more time.
Now listen again
Pronunciation
and
is
repeat.
it's a kind of
A painkiller.
difficult.
Cold tablets. A nasal spray. A decongestant. Eye drops. An antihistamine.
Cough medicine. An antibiotic. An antacid. An ointment. Vitamins.
Okay. Any questions so far about, do you know what is a painkiller? When you have a terrible headache, you want a painkiller. Painkiller is just a pill that makes you feel better or that cuts the pain that you're feeling, obviously, on your head. A painkiller. What would be a painkiller? You can have a painkiller when you have a headache, but also when you have a sore throat, or probably when your back hurts, you can have a painkiller. Okay? Now, when you have a terrible headache, which are the names of some painkillers that are very famous that we might drink, we might take? Could you tell me the names?
Aspirina.
Aspirina. Uh-huh. Another one?
Panadol.
Panadol. Uh-huh. But when you have a very, very delicate headache, probably you will take Migradorixil for the migrañas. I don't know. But those are the type of painkillers, okay? Cold tablets. It is very common and they don't need a prescription. Also, the painkillers, there are certain type of painkillers that they have a prescription. The cold tablets, tell me the most famous cold tablets that we go to the pharmacy and we ask for them. Tapsin, liquid gels. Yes, liquid gels de noche y de día. Those are the cold tablets. Nasal sprays and decongestion. Sometimes people, they use this type of medication because they are like allergic to certain type of weather, or they are allergic to different type of things, and they get it's very difficult for them to breathe. So they use a nasal spray or decongestion in order to have the nose free and they can breathe better. Okay? The eye drops. Some people, the people that wear glasses all the time, probably they need eye drops in order to hydrate their eyes. Another type of eye drops, probably you have a certain type of treatment in your eyes, or you had a surgery, you need eye drops. Antihistamine. What is antihistamine? ¿Qué hace un antihistamine?
Aliviar los síntomas.
¿De qué?
De una alergia.
Yes, antihistamine, those are for when you are allergic, probably to something. You are allergic to when you, probably to food, or it could be to the weather, or it could be to the dust, or it could be to the, I don't know, another type of thing that probably you're allergic to. Antihistamine. Cough medicine. What could be a cough medicine? Cough. What is a cough medicine?
Jarabe para la tos.
Very good. Yes. An antibiotic. An antibiotic. What would be an antibiotic?
For infection.
For an infection. Yes, and probably this type of antibiotics, they need prescription. Depends on the antibiotics name. That is in the way they prescribe you. But they're a little bit more stronger because it's supposed that they kill everything that is giving you this type of reaction in your body. An antacid. What would be an antacid?
It's protect.
It's probably to protect your stomach. ¿Cuánto toman ustedes antiácidos? Probably you ate too much. Cuando comieron mucho. Yes?
When we get like fireburn, I don't remember what's the name, but it's like fire something.
Heartburn. Heartburn means acidez. Yes. So you have an antacid.
For example, you can drink Pepto-Bismol.
Yes.
Yes.
¿Cuándo usan el Pepto-Bismol? ¿Para qué es eso?
For the stomach ache.
Mm-hmm.
Am I right?
Yes, stomach ache. Not necessarily a stomach ache, but ¿para qué usan el Pepto-Bismol? ¿Qué les alivia?
La diarrea.
También, ¿qué más?
I don't remember that word. I'm sorry.
Don't worry. Diarrhea. Diarrhea. Okay, don't worry. Now, let's go to an ointment. What is an ointment? Do you know? Yes, what is an ointment? Ungüento. Es cualquier cremita que le dan a ustedes. Por lo general, esas cremas, ¿para qué son? Alergias, picaduras de zancudos, mosquitos, alguna reacción a algún medicamento y brotó una alergia. Probablemente no le cae muy bien. Okay, so that is an ointment. Vitamins. Do you take vitamins? Yes or no?
No.
No, okay. Some people, when we're little kids, if you have children, probably when you have children, doctor asks you to give certain type of vitamins to the kids. Okay, so they can grow, and they have enough strength because they burn a lot of energy. Okay, now let's go for the next audio. In the next audio, you're going to listen to a conversation with a doctor and a patient, and you have to complete it with the symptoms and the type of prescription the doctor is giving, the type of medicine. And you also have to listen if the medicine, they have side effects. So this listening is divided in two. The first part with the name of the patient, the pain, and the type of medicine they receive. And in the second one, it's supposed to tell you the dosage, if they have the side effects, and which are the side effects. So let's try to do the first part. Okay? Only remember that this type of exercises, you need to pay attention only in the information that they're asking you. In the first one are symptoms, the name of the medication, and no, you already have the name. And that's it. Okay? And they're asking you if the patient is taking in any medications. Yes or no. Sometimes you go to the doctor and you, by yourself, you have been taking medications. Okay? So that's what they ask.
Listen to each conversation with a doctor. Use the medications vocabulary above and the symptoms vocabulary from page 16 to complete the chart for each patient. Conversation 1.
Ms. Yilmaz, I'm Dr. Lee. I understand you're here on business?
That's right. I'm from Turkey, actually.
And you are not feeling well?
No, I'm afraid not. My back has been killing me for several days now.
Are you taking anything?
Just some painkillers, but they're not really helping.
Let me give you a prescription for a stronger painkiller. I think you might find it very helpful.
Does it have any side effects?
Well, for very few patients, it causes nausea or vomiting, but that's very rare. I really don't think you'll have to worry. Call me if you feel at all nauseous, okay?
Okay, thanks.
The dosage is 1 tablet in the morning, 1 in the evening with food. The pharmacist will give you a full set of instructions when you pick up your prescription.
Thank you, Dr. Lee.
Okay, so the first one, what are the patient symptoms? She's in pain. Where?
In her back.
Okay, so probably she has a back pain. Is she taking any medication?
Yes.
Yes. So what is she taking?
Some painkillers.
So those were the only thing that you're supposed to write. And this one are the painkillers. And that's it. Now, the other one. Did the patient get a prescription?
Yes.
Yes. Okay, very good. Let's go to the number 2.
Conversation 2.
Lucy Fernandez? I'm Dr. Hirano.
Thanks so much for fitting me in.
My pleasure. Where are you from?
Mexico. I'm here on business.
Oh, you're a long way from home. What can I do for you today?
Well, I've got a splitting headache, and I've been kind of nauseous since Monday.
You must feel terrible. Are you currently taking any medication?
I've been taking an antacid and a painkiller.
Are you allergic to any medications?
I think I might be allergic to penicillin, but I'm not sure.
Well, that's okay. Keep taking the painkiller for that headache, but you can stop taking the antacid. I'm going to give you a prescription for your nausea. Take it twice a day.
Will there be any side effects?
It might make you a little tired during the day, but chances are you'll be fine. Call me if you don't feel better.
Okay.
Conversation 3.
So the symptoms are?
Nauseous.
Nauseous and?
Headache.
Very good. Is she taking any medication?
Yes.
Which one?
Painkillers and antacid.
Very good. Did the patient got a prescription? Yes.
Yes.
She got a prescription. Yes and yes. Okay, let's go for the number 3.
Dr. Benson? Hi, I'm Mark Go.
Hello, Mr. Go. I hear you're not from around here.
Right. I'm visiting from Hong Kong for a few weeks.
You've come a long way to see a doctor. Well, what can I do for you today?
My eyes have been really red for about a week now.
Have you been using any medication?
Well, I got some eye drops at the drugstore, but they aren't helping.
For your condition, I think you might want something stronger. I'm going to give you a prescription for an eye ointment. Use it twice a day and wash your eyes several times a day.
Okay.
It's a strong medication, but there aren't any side effects you need to worry about. If you keep your eyes clean, the ointment should do the trick.
Thanks.
Will you still be here next week? I'd like you to come back to see me.
Yes, I'll still be here.
Good. You can make an appointment at the front desk on your way out.
Thanks, doctor.
Okay. So, which are the symptoms, patient? He went to the doctor because he has what?
Red eyes.
Yes. So the patient's symptoms are he has red eyes. Is he taking any type of medication?
Yes.
Yes. Which one?
An ointment.
Eye drops. And did the patient get a prescription?
Yes.
Yes. And now let's go to this one. In this section, you will have to write, okay, one more time, the tablet, side effects, and which one.
Listen again. Complete the information about each patient. Conversation 1.
Ms. Yilmaz, I'm Dr. Lee. I understand you're here on business?
That's right. I'm from Turkey, actually.
And you are not feeling well?
No, I'm afraid not. My back has been killing me for several days now.
Are you taking anything?
Just some painkillers, but they're not really helping.
Let me give you a prescription for a stronger painkiller. I think you might find it very helpful.
Does it have any side effects?
Well, for very few patients, it causes nausea or vomiting, but that's very rare. I really don't think you'll have to worry. Call me if you feel at all nauseous, okay?
Okay, thanks.
The dosage is 1 tablet in the morning, 1 in the evening with food. The pharmacist will give you a full set of instructions when you pick up your prescription.
Thank you, Dr. Lee.
Okay, the dosage, 1 tablet.
In the morning and 1 in the evening.
Entonces esa sería 1 tablet. Twice a day. Side effects?
Yes.
They have side effects. And which are the side effects?
Nauseous and vomiting.
Nauseous and vomiting. Imagine that. Okay. Next one.
Conversation 2.
Lucy Fernandez? I'm Dr. Hirano.
Thanks so much for fitting me in.
My pleasure. Where are you from?
Mexico. I'm here on business.
Oh, you're a long way from home. What can I do for you today?
Well, I've got a splitting headache, and I've been kind of nauseous since Monday.
You must feel terrible. Are you currently taking any medication?
I've been taking an antacid and a painkiller.
Are you allergic to any medications?
I think I might be allergic to penicillin, but I'm not sure.
Well, that's okay. Keep taking the painkiller for that headache, but you can stop taking the antacid. I'm going to give you a prescription for your nausea. Take it twice a day.
Will there be any side effects?
It might make you a little tired during the day, but chances are you'll be fine. Call me if you don't feel better.
Okay. The dosage? Twice a day.
Twice a day.
Twice a day.
Side effect? Yes. And which could be the side effect?
She would be so tired.
May cause tiredness. Okay? Cansancio. Tiredness. May cause tiredness. Next one.
Conversation 3.
Dr. Benson? Hi, I'm Mark Go.
Hello, Mr. Go. I hear you're not from around here.
Right. I'm visiting from Hong Kong for a few weeks.
You've come a long way to see a doctor. Well, what can I do for you today?
My eyes have been really red for about a week now.
Have you been using any medication?
Well, I got some eye drops at the drugstore, but they aren't helping.
For your condition, I think you might want something stronger. I'm going to give you a prescription for an eye ointment. Use it twice a day and wash your eyes several times a day.
Okay.
It's a strong medication, but there aren't any side effects you need to worry about. If you keep your eyes clean, the ointment should do the trick.
Thanks.
Will you still be here next week? I'd like you to come back to see me.
Yes, I'll still be here.
Good. You can make an appointment at the front desk on your way out.
Thanks, doctor.
Okay. Apply the ointment.
Twice?
Twice a day. Very good. Are there any side effects?
No.
No.
No side effects. Okay.
It's the same egg, teacher.
¿Ah?
It's the same egg de la conversación del ejercicio 1, que tenía malos ojos.
Ajá. Yes.
It's the same. Okay.
Yes,
No
it's the
la
same.
primera.
Okay. Yes, it's the same. Okay. They're giving. Now, any questions about the vocabulary? Any questions about this one? No? Okay. Okay, guys, with this one we finished the unit number 2. Okay. Con esta terminamos lo que es la unidad número 2 ya. Okay. Mañana empezamos con la 3. Ok, y así vamos, todavía tenemos 1, 2. Tenemos 2 semanas exactamente para empezar. Sí, vamos bien con el tiempo. Ok, questions? No?
No.
No? Okay, guys, thank you very much, and I see you tomorrow. Okay, thank you, guys. Have a nice day.
Thank you. Have a nice day.
Bye, guys. Thank you.
Bye, teacher.
Bye, guys. Take care.
Bye, teacher.
Bye, Lee.
Bye, teacher.
Bye, Julio.